Hi everyone, I'm Ali GREYMOND. Today I'm answering questions about OCD recovery. These are the questions that you left below my video. First question. Hi Ali, thanks heaps for your continuous support. Since I stopped reacting to the thoughts, the anxiety has decreased heavily the past couple of months. However, the thoughts and feelings are still present without fear nor anxiety, and it feels like now I truly agree with the content of the thoughts and they feel more real than ever. I feel a sense of shame and guilt due to that. Is this normal? You know, I think that your theme has shifted, and I think that you are now focused on why do I still have the thoughts when I don't have anxiety? And because that's what you're sending to your mind, how can I get thoughts without anxiety? Or why am I getting thoughts without anxiety? And what does this mean? This is what it's sending to you more. And then you are getting anxious about it, and then obviously analyzing and also buying into the sense of shame and sense of guilt. It's This is still OCD, just slightly shifted in how it's presented to you. I actually have this question quite a bit when people ask me that it comes in without anxiety, and does this matter or is this different? It's not different, it's still OCD. You certainly are reacting with a lot of anxiety, so there's that. So you have to look at it that there is anxiety present. And you need to refuse reaction. And obviously, if you're wondering, well, is the anxiety present? You're posting the question. So, yes, the anxiety is definitely present. Again, like I said, it just switches from one angle to another. Still OCD, still disregarding. Shame has to have to disregard. Guilt have to disregard as just byproducts of the thought. You have nothing to feel bad about. This is happening to you. These thoughts are coming to you. You're just kind of the observer. So refuse reaction. You will see. This is why, you got better, but now you need to finish the process. And because it shifted a little bit, that now it's coming in without anxiety, you're starting to view it as like, well, what does this mean? And now you're bringing it back. And if you're not careful, what's going to happen is you're going to start to slide back and actually undo the progress that you've made. So you have to view it the same. You have to get tough no matter what it tells you. If it has to do with the same general theme or themes that you normally have, anxiety, no anxiety, doesn't matter. Still OCD, still disregarding. It has to be like your mantra. Next question is, how is it good to do ERP? Work with an exposure for 2, 3 weeks or work on multiple exposures? I would suggest working on multiple exposures, because if you work on just one exposure at a time, there's a big chance that as one is getting better, the other ones are getting worse, because the brain will try to find an outlet, so it will try to grab on to the other stuff to kind of counteract the fact that you're reacting less to this one. So 5% or more as you can less each day compared to the previous day, as much as possible, but across the board. So everything you do, you're doing 5% less reassurance, 5% less on of rituals. Ideally, you want to do more, but I'm saying a bare minimum is 5%. Each day, adding more 5%. Next question is, hi Ali, how do you do exposures while remembering that the thoughts are false? So you're not trying to chase the feeling, right? So you're saying, I know the thoughts are false. They're the same thoughts I've had for a long time, and I'm refusing reaction because now I'm choosing to be done. No matter how you feel, no matter how real they feel. So it comes from a choice. So you've made a choice, and now you're sticking to it no matter what. You're not analyzing the choice, you're not trying to figure it out. You're just choosing to move on because you've had enough, basically. You know, that's how you have to approach it. Next question is, hi Ali, is constipation and stomach discomfort caused by ERP or anxiety spike? First of all, I just want to say that constipation, stomach issues of any kind, when you are having an OCD situation, is extremely common. And at the end of the day, it is anxiety. It's extreme stress, extreme anxiety that causes this. Now, this doesn't happen for everybody with OCD, but it happens for um, I would say, just based on my experience of doing this for 10 years, I would say about 50% of the people. So for some people, yes, for some people, no. And then it's also, it might not be every time as well. Um, so, but it is fairly common, and it can go either way. So you can have just irregular, I would say, stomach situations, in whatever way it kind of works um, for you. But it is just because of extreme stress, extreme anxiety. So it's when you're asking, is it caused by ERP or anxiety spike? Well, ERP is not a pleasant process. It is anxiety. So it is caused by both, because both are anxiety. ERP, it gives you anxiety because you're choosing not to react, which is unpleasant and anxiety producing in itself. So and OCD causes anxiety. So it's, especially in the beginning, this happens. This will stop once you get to, I would say, like 6 out of 10 OCD, 5 out of 10 OCD. It's only when you're extremely anxious that you will get these symptoms, because again, that's just how the body reacts to it. Next question is, uh, actually, the person has three questions. What if an OCD thought just keeps popping out and coming out of nowhere? What is best thing to do? That happens for everybody. You just do nothing. You keep going with your day. If you need to write it down, what you want to do in the day, write it down. Like, make a list, have a plan, and you're just going along that plan. You will feel like a robot. It's okay. It's temporary. But for now, you just need to follow the plan and not give in to whatever OCD tells you. Next question is, when you say disregard the thoughts, do you exactly mean ignore them? I just want to clarify that too. Do we need to pay attention to it at all, or just let it be there? Many of us OCD sufferers can't tell if we're disregarding or simply avoiding it. Okay. When I say disregard, I do mean ignore. How do you know if you are avoiding it in a bad sense? Is, are you doing it from a position of fear, or are you refusing to do something because you fear it? So um, disregarding the thoughts means, I don't want to touch this doorknob um, because it gives me anxiety. So I'm gonna disregard that, and I'm gonna choose to touch it anyway, right? Avoiding would be, no, I'm just gonna do something else so I don't have to be anywhere near this doorknob because I don't want to touch it, definitely, and I'm scared, or I'm just gonna use my shirt or whatever to open it because I don't want to do that. That's avoiding it. When you're doing that, you're doing things out of fear. When you're disregarding, basically, it's like you don't care what OCD tells you. There's no fear there. Well, you might feel fear, kind of residual fear, but you're choosing to step over the fear and go against what OCD wants you to do anyways, right? So it's just stepping over the fear, doing things versus avoiding out of fear. So that's the big difference. Um, Lastly, this is for everyone's benefit. When is reassurance just okay? Just asking because I realized that whenever I have OCD or HOCD attack, a sudden thought or memory would appear that reminds me that I am a full straight guy. Sorry for all these questions, but my questions would really benefit everybody. Thank you so much, Ali. God bless. Um, so, when is reassurance just okay? Well, like what you're saying here is, you're saying, so the person is saying, so when they're having an OCD attack, some memory comes up that reminds them that there's no need to worry. And sometimes that automatic reassurance happens, and that's okay. I think that's kind of beyond your control anyways. But I would say, but beyond that, I would say, if you are in a situation where, for example, you get an OCD attack right before an important event, right before, say, if you're in school, an exam, an important meeting, then it might be beneficial in terms of your entire life, not just the OCD recovery, but entire life, um, to do reassurance in the moment and then pick it up after. But this has to be extremely rare, because every time you're doing reassurance, you are taking a step back. I'm just kind of looking at it. When I say this, I look at it from a position of, this is definitely not your last thought. This is definitely not the last time you fall back and do reassurance behavior, for most people listening to this, right? So you might as well not mess up the interview, not mess up the exam, you know but at the same time, when you do reassurance, most of the time it backfires by giving you extra information that you didn't expect to get, that will get you even deeper into it. So you think it's going to get you out of it and you're trying to figure it out, but it actually gets you deeper into it and you have actually more questions than before you started and you're almost sorry you did reassurance. So make of that what you will, and you have to make kind of decisions. Sometimes also, just like you said in the third question there, that sometimes things are obvious and the thought just pops into your mind automatically that, like, wait a minute, this is silly. And some things are kind of harder to get through for people. So it all kind of depends. But again, in order to recover fast, you need to show your mind in a very clear message: this is an OCD thought. I'm not reacting at least 80% of the time. So it's okay if you're starting very low, if you're starting with 100% reassurance, but you have to refuse every day more and more, you know, with with the idea that you need to get to 80, I would say 90% of no reassurance. So you're sending a clear message to the brain that this is no longer relevant. Okay, so next question along the same line is, how do I deal with the fear of having OCD during an important life event coming soon? So, okay, so say for example, something important is going to happen. Say, I don't know, a wedding, for example. Um, and as you are getting closer to a birthday, is another example, a holiday. Um, as you are getting closer to this event, um, the anxiety is going to be rising because you want things to be perfect, because you are preparing for it. Everything has to go smoothly. You know, um, I would say that the best thing is just to say, you know what, I have OCD right now. I'm working on recovery, and I'm just going to do what I'm going to do. It's going to be okay. It's just going to go how it's going to go, you know? Because then you take pressure off, right? um I would say, and I'm usually, again, I'm usually not into taking medication, but for these kinds of events, something that you can take also, that's or at least knowing that you can take it. Like, you don't actually necessarily have to take it, but obviously, but just having it available would help, just to know that. But I mean, like, stuff that's, that works quicker, like what they call as needed medication. um just to get you through the day, and again, you guys have to be very careful with that kind of medication because it is addictive. But it might, you know what I mean, just get you through that difficult moment. But if it's like something like an interview or an important business meeting, I don't suggest taking that kind of medication because that can backfire on you as well. But if it's more like a family event or something like that, then that might be a good idea. So and if you can, um try to make not so big of a deal of it. Like, okay, you know what, it's like, even if it's a wedding, right? Like, or something like very, like, once in a lifetime important kind of thing. Just try to look at it that, you know what, it's gonna go how it's gonna go. It's just a party. It's gonna be fine, right? Like, kind of like, take the importance down rather than to say that, oh, it's the most important thing that's ever gonna happen, because then you're just gonna bring yourself way too high with this, and then it's gonna be difficult. Okay, next question is, please make a video on sexual urges and OCD. What is the correct ERP for that? So, any OCD thought you have to disregard, whether it comes as a form of an image, a thought, a memory, an urge, a physical sensation. It's still OCD. So, however it comes in, choosing to disregard, choosing not to pay attention to it. Even if it's a sexual urge, it makes absolutely no difference. Believe me, I've been talking to people for 10 years. It's all the same thing. It's always OCD. It's never going to be real. It doesn't matter what the theme is. People a lot of the times get stuck, well, because it's a sexual theme. Well, what does that mean? Why is it this theme? Why is it not another? I'm telling you, I talk to people with all kinds of themes. They're all equally bad. They're all equally um, distressing to people. So don't think that if you had some other theme, it would be easier. It wouldn't be. You just have to disregard. An urge is a very, very common thing in OCD. Sometimes it can come in as an urge. Sometimes it can come in, like I said, like, it can come in as anything. you know, can come in as a dream even, you know what I mean? So okay, in dreams, I mean, like it could be anything. So just whatever, false memory, common one as well, like it's, just disregard. And people, even like if you take sensory motor OCD, right? People can actually feel physical discomfort on a physical level, and that's also OCD. So an urge is definitely OCD, disregarded like any other theme. Next question is, hi Ali, how can I identify that I am doubting a thought? uh, how can I identify that I am doubting a thought as an OCD thought? Thank you. Um, I'm not really sure what you mean by this. Okay, so I'm gonna reply to it in the way that I'm understanding your question. So, if a thought comes in, gives you anxiety, even like I said in the first question, if it doesn't come in with anxiety but gives you anxiety after, the anxiety about no anxiety kind of thing, or it comes in with anxiety, or it comes in as an image, or it comes in as an urge. Because again, like even like with the urge itself might not give you anxiety, but you might feel the anxiety after. So there's another example for the first question that I answered as well. Um, but if you're obsessively doubting, if you're trying to figure it out, if you feel the urgency to solve, if it follows the same thought pattern, the same theme, or the same themes, all of that tells you that this is OCD. So, and the doubting, obviously, how am I doubting a thought? You generally will not obsessively doubt regular thoughts. So if you think it's OCD, I bet you it's OCD. Next question is, hi Ali, I had a question about OCD and PMS. It seems I struggle with it the worst around this time. So my question is, how do you carry on recovery when hormones are there? Thank you very much, and you have helped me a lot. I'm seeing great progress. I'm very happy that you're seeing progress, and during that time, it's just harder. So you have to do the best you can. Understanding why you are feeling worse will help, because then you can see, okay, I don't feel worse because this is somehow valid. I feel worse because this, and this. I had PMS. I overreacted. I just didn't disregard, whatever the thought is, whatever the situation is. I experienced this trigger. So kind of putting it together of, this is why this is an OCD thought, not in a way of reassurance, but just understanding, and also preparing yourself for that time that, okay, I'm in that, monthly cycle right now. Chances are I might feel worse, so I'm prepared. And when a thought comes in, which is it will, I'm gonna disregard. Um, Not being scared of it, and just looking at it that, what, for now I'm just gonna disregard based on all of these like symptoms, based on all of these patterns, right? And then in the week, if this is still important, and I can reevaluate, and that might give you a little bit of breathing room, kind of like, you know, I'm not disregarding the thoughts completely, because if you feel like you just can't in the moment, so you're delaying it. So you're kind of like, you're not walking through the door of reassurance, but you're kind of leaving it open, like I can if I want to, but I just won't, and sometimes that's an easier out. And then see how you feel in the weekend. It should feel a lot different, even though it feels very real in the moment. After a while, it starts to lose power, and then you start to see more of the reality if you're not solving it. But just as much as possible, refuse solving it, even if it's just for a few days. Next question is, hi Ali, I've had all themes of OCD, and my main theme is in the past year has been sexual identity. I'm wondering, what advice can you give me on how to see these as thoughts and nothing to do with who I am? So you have to say, uh, this just again, just like I was talking about urges, just like I was talking about, what if it doesn't give me anxiety? It's OCD. This just started. It doesn't matter. I'm disregarding it. So you're choosing to move on. This is a very, very common type of OCD. You know, don't analyze, don't try to chase the feeling, because a lot of the times with the sexual identity stuff, the person really chases the feelings. Well, I'm looking at, oh, you know, this good looking person, I should be feeling attracted. I am not feeling attracted. What does this mean? Blah, 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 blah. My whole life is going to be turned upside down, and you start to spin it in your mind rather than to say, this is OCD. Just because it has to do with this topic, it's not different. Believe me, it's not different. I see this all the time. So it's not different. just choosing to move on, who cares? And when you start to look at it this way, you will see that these feelings after a while will uh, lose power, but it's going to take a little bit of time. And don't try to like test it, like, is it losing power now? How is it compared to yesterday? I'm not sure. It doesn't feel better, or does it? And you start to really get into it rather than to say whatever, whatever in the situation as much as possible, you know just because it has to do with the steam, it doesn't matter. It's not different. Next question is, hi Ali, do you think that OCD involves some inborn physiology problem with the brain? If so, then it seems that we are vulnerable to relapse even after recovery. What is your experience on this issue with your clients after years of helping them so far? So, you know, I can tell you that every person who I've ever spoken to, I mean, I believe there was only a few people who didn't fall under this category over the years. And, I mean, everybody would kind of classify themselves differently. So, that's kind of up for debate, anyways. But okay, let's say 99.999 percent of the people have been born not born, but from birth have been extremely sensitive. So, after you recover from OCD, so you recover from the themes that you've had, you know, chances are you're still going to be very sensitive. So, what I suggest is first understanding, in-depth understanding of how OCD works. And that's why I bring this up, how I talk about the little boxes and the 50,000 thoughts a day and all of this kind of stuff, because it's important for you to understand. Like if somebody wakes you up in the middle of the night and they tell you to give a lecture on how OCD works, you need to be able to do that. So not I am telling you, you need to be able to tell me how OCD works at any time during the day or night. It needs to be in the subconscious, because that way you don't get caught off guard. You also need to understand, and this is why these Q&As are really good, is you need to understand not only how your specific theme works, but how other people's themes work to at least some extent, or at least know about their existence. For example, people ask me a lot, like sensory motor OCD. I feel like actually something is bothering me. I feel like I'm blinking too much. I feel like something hurts. All those kinds of things. You don't really expect it to be OCD, and your local doctor might not know that it's OCD, but it is. And if you're not prepared, then it might come in. So, because you are right that if a person is more sensitive, the chance of relapse, or the chance of getting OCD was high in the beginning, which is why you got it, and there is a chance of relapse. So this is how you protect yourself from relapse: is having an in-depth understanding about how OCD works, most common themes, because I'm telling you, there's not a lot of variety with OCD. It pretty much cycles between what, 10 to 20 different themes, and that's pretty much all it can come up with. You know, um, then also I would say doing ERP for regular things that stress you out in everyday life, because we all have worries that, like, OCD is more kind of outrageous worries, right? But there's also OCD about like you can have OCD about relationship, OCD about different illnesses, and it's, you can't tell me that people who don't have OCD, who never experienced OCD, they never worry about relationships, they never worry about illnesses, they never worry about finances, right? But a person with OCD will take it to an extreme. So once you recover from that, you have to make sure you continue to keep it in check and not take it to the next level about the things that are important to you. Um, so that will keep you on track. And another thing I would say is reducing stress. You want to make sure you are not overly stressed, because, again, being sensitive, putting too much on yourself might put you, especially when you're freshly recovered, that's when you're the most vulnerable, or when bad things are happening in your life, which we all have bad things happening from time to time. So those times are when you're the most vulnerable. Don't put more pressure on yourself. Try to give yourself room to adjust. give yourself room to heal in these situations. If you are in a situation where you have to be stressed, you don't have any option, like this is what, like for example, students with exams, or teachers with giving exams, or a new job, or whatever the situation may be. um, Try to at least even out the stress, so it's not like, okay, today I'm doing everything and then tomorrow I have a day off. It has to be equal stress each day, because that will, it will normalize it, and your mind will get used to that level of intensity, especially if this is the intensity that's going to be lasting for a while. So those are just some hints that will help you stay on track past recovery. But I'm telling you, do ERP for every aspect of your life. Like, if you are worrying about finances too much, why am I worrying so much? Is this really benefiting me? I always try to look at things in this way. What is your right now? Like, you have some sort of a problem in real life. I don't mean like OCD stuff, but in real life. This is we're talking here past recovery, right? What can you do in this situation? Like, your actual actions. What can you do? If there's nothing you can do, if you're just dwelling on things and it's out of your hands, or it's something from a long time ago, or if it's something from way too far in the future, you know, why are you spending your life worrying about it? I did my part. Everything else, it's going to be what it's going to be. It's not up to me. However things turn out, I will deal with them when they turn out. Having that kind of mindset will strengthen you, make you less vulnerable, make you less sensitive, which will help to ensure that you don't get a relapse. I'm going to stop the first part here just because it's already long and probably nobody's listening at this point. But if you haven't subscribed yet, please subscribe. If you would like to do the recovery program with me, as always, all the information is on youhaveocd.com. Thank you so much for watching. I will be back with the part 2 tomorrow.